So good morning. Thank you for joining Community Health Council's Day 1 of Women in Equity Securing Our Economic Future. I'm Diane Segura. I'm our Policy and Government Affairs Director for the organization, but more importantly, I'm your MC for this morning. So we wanted to make sure that we did a little bit of housekeeping items for those that have joined us already this morning and those that continue to join this morning. We want to make sure that all presenters and speakers try to do their best and speak slowly so that our interpreters can keep up with making sure that everyone captures every aspect of what we discussed today.
Good morning, Diane. If I may, this is Pilar. In the general meeting, I was asked to give the instructions in Spanish here.
Yes.
To make sure that everybody moves into the right interpreting channel so that they can hear Ruth, who is interpreting now. So, buenos días a todos. Muchas gracias por unirse a esta reunión. Queremos decirles, por favor, que tenemos disponible interpretación en inglés y en español, y para que puedan estar en el canal adecuado necesitan apretar un globo que sale en la parte de abajo de la pantalla de Zoom si está usted en una computadora o en una computadora portátil. Si está en un dispositivo móvil, tiene 3 puntitos que dice más o more, necesita apretar ahí, elegir su idioma, y es muy importante que también enmudezcan o mute el original para que podamos estar todos en el mismo canal y nos podamos escuchar bien cuando participemos y escuchemos a los intérpretes también. Muchas gracias.
Okay, let's get started. Kicking off our summit this morning is our CEO, Veronica Flores. Veronica is a change leader, systems leader who has continued the legacy of our founding executive director, which many of you know her as simply as Lark. Her vision, specifically Veronica's, is to take not only her years of community activism, but work closer with leaders like you who are here this morning with us to address the systems, issues, and efforts that affect our communities. Not only in the communities as we look at our health, but our well-being and our economic prosperity for our communities. She is a board member of the LA Food Policy Council. She also serves with Charles Drews University President's Council. Those are just a few highlights for Veronica, but please take it away, Veronica.
All right. Well, good morning, everyone. And just checking, everything good? All righty, perfect. So good morning and welcome. This is our 3rd year that Community Health Councils is sponsoring the Exploration Summit. This year's theme is Women, Wealth, and Equity, Securing Our Economic Future. So we're particularly excited about this year's convening because it is a 2-day summit. Now, as in previous years, we'll highlight community-based participatory research. It's too early in the morning, I need coffee. We'll highlight participatory research methodologies, best practices, and equitable data collection and analysis. This year, however, we're adding the space for practitioners to propose solutions based on their current efforts, implementing innovative systems change strategies in healthcare, economic parity, and place-based initiatives. Our ultimate goal is to continue to create and support spaces aimed at finding solutions from diverse sectors that can help us chart a path forward in closing the wealth gap for women of color, and in using and developing evidence on how investing in women, specifically women of color, will help secure the economic future of Los Angeles and beyond. As I am sure you're all aware, community-based research is a critical foundation for accelerating truth and promoting social change. It is even more critical during this current environment, filled with shameless lies at the highest levels of our government, at a time when the culture of research and truth-telling is considered elite and anti-American. Last night's presidential debate, if that can be called such, was a blatant demonstration of this and much more. We have lived through difficult times, but that have challenged our democracy and in many cases exposed our lack of morality and humanity. And during these times, extraordinary leaders stepped forward to give voice to others, and grave movements were born. We're here again, and history is repeating itself. We can speak of Black Lives Matter and its impact on all of us differently today as compared to even 2 years ago. This represents a culture shift that is leading to movements that must remain. These are wins, and we have to make them count. John Lewis said, "You cannot be afraid to speak up and speak out for what you believe. You have to have courage, raw courage." The definition of community-based participatory research, CBPR, is a partnership approach to research that equitably involves community members, organizational representatives, researchers, and all other aspects of the research process, with all partners in the process contributing expertise and sharing in the decision-making and ownership. The aim of CBPR is to increase knowledge and understanding of a given phenomenon and to integrate knowledge gained with interventions for policy or social change benefiting the community members. Well, women of color have long been the backbone of social movements in the United States, but their legacies tend to be absent from history books and erased by those who benefit most from our silence. These are women who choose a path of activism and was speaking out so others could remember the ones that have been erased or silenced. What about Breonna Taylor? What do we do with that? The violence that is ongoing against Black and brown women must stop. Clearly, those of us in the social justice space speak about anger, of our role in creating change. And we need a coalition that is prepared with knowledge and strategy to make this sustainable. We need to be the ones in charge of our own data, our own interpretation, our own words, our own strategies, and most importantly, to be absolutely certain that we must find and live in sisterhood. This is why we're here today. We must stand together on solid ground and show our young people and our citizens that our resolve is unwavering, that we are showing up with open minds and hearts to this coalition so we can organize and strategize across sectors, communities, and political lines. Our lives depend on our ability to swell civic participation, change the narrative around apathy within our communities, and ensure that those hard-won civil rights victories live on. Today's convening is focused on people-powered, place-based initiatives that are happening in South LA. You will hear lessons learned and best practices for place-based system change efforts as evidenced in 3 highly visible initiatives currently being managed by CHC. First, 5LA's Best Start Communities, the California Endowment's Building Healthy Communities, and LA Care Health Plan Healthy Kids Zone. Tomorrow, the focus will be on wealth stripping and the impact of debt on mothers in South LA. You will hear the findings from our study on the racial and gender wealth gap conducted over the summer by our partners at UCLA, which highlights the perspective of Black and brown mothers on the economic impacts of the Corona recession and the civil unrest across our communities. These findings and related discussions are meant to help build a case for eliminating debt in communities like South LA as a mechanism for economic resiliency and wealth building in communities of color. Local action and bottom-up approaches are vital. So let's take this opportunity to learn, strategize, share, and more critically, collectively figure out how we become more sustainable and equitable for future generations to come. Now I'll ask Sadio and Jessica to come forward. Thank you.
Good morning, everyone. My name is Sadio Woods, and I'm a coordinator of a regional initiative at Community Health Councils. And today I wanted to share with you a few words from one of our esteemed poets, Audre Lorde, that I think is really timely right now. And I think these words really resonated with me, and so I hope that they will resonate with you. And this is from a keynote presentation that was given at the National Women's Study Association Conference in Storrs, Connecticut. My response to racism is anger. I have lived with that anger, ignoring it, feeding upon it, learning to use it before it laid my visions to waste for most of my life. Once I did it in silence, afraid of the weight. My fear of anger taught me nothing. Your fear of that anger will teach you nothing also. Women responding to racism means women responding to anger. Anger of exclusion, of unquestioned privilege, of racial distortions, of silence, ill use, stereotyping, defensiveness, misnaming, betrayal, and co-optation. My anger is a response to racist attitudes and to the actions and presumptions that arise out of those attitudes. If your dealings with other women reflect those attitudes, then my anger and your attendant fears are spotlights that can be used for growth in the same way as anger for my growth. Anger is loaded with information and energy. When I speak of women of color, I do not only mean Black women. The women of color who is not Black and who charges me with rendering her invisible by assuming that her struggles with racism are identical with my own has something to tell me that I had better learn from, lest we both waste ourselves fighting the truths between us. If I participate, knowingly or otherwise, in my sister's oppression, and she calls me on it, to answer her anger with my own only blankets the substance of our exchange with reaction. It wastes energy. And yes, it is very difficult to stand still and to listen to another woman's voice delineate an agony I do not share, or one to which I myself have contributed. Audre Lorde, June 1981. Thank you.
Thank you for those powerful words, Sadio. Good morning, everyone. My name is Jessica Melendez. I am the manager of community initiatives for Built Environment here at Community Health Councils, and I manage the Healthy Kids Zone project at Fremont High School. I'll be reading a few words from Gloria Ansaldúa, a powerful scholar, and one that, or her words resonate with me and help me empower me, and I hope that these words that I'm about to share as well help empower you throughout the day and throughout these next few months as well. So I'll go ahead and get started. To live in the borderlands means you are neither hispana, india, negra, española, ni gabacha. Eres mestiza, mulata, half-breed, caught in the crossfire between camps while carrying all 5 races on your back, not knowing which side to turn to, run from. To live in the borderlands means knowing that the India in you, betrayed for 500 years, is no longer speaking to you. The Mexicanas call you rajetas, that denying the Anglo inside you is as bad as having denied the Indian or Black. Cuando vives en la frontera, people walk through you. The wind steals your voice, you're a burra, buey, scapegoat, forerunner of a new race, half and half, both woman and man, neither, a new gender. To live in the borderlands means to put chile in borscht, eat whole wheat tortillas, speak Tex-Mex with a Brooklyn accent, be stopped by La Migra at the border checkpoints. Living in the borderlands means you fight hard to resist the gold elixir, beckoning from the bottle, the pull of the gun barrel, the rope crushing the hollow of your throat. In the borderlands, you are the battleground where enemies are kin to each other. You are at home, a stranger, the border disputes have been settled, the volley of shots have scattered, the truce you are wounded. Lost in action, dead, fighting back. To live in the borderlands means the millet with the razor white teeth wants to shred off your olive skin. Crush out the kernel, your heart pound, you pinch, you roll out, smelling like the white bread, but dead. To survive the borderlands, you must live sin fronteras, be a crossroads. And that was Gloria Anzaldúa.
Thank you. Just needed a moment there. Now, it is absolutely my privilege and pleasure to introduce someone very dear to us and to me, Dr. David Carlisle. Presently serving since 2011 as the President and Chief Executive Officer of Charles Drew University of Medicine and Science in the Watts Willowbrook area of Los Angeles County, CDU. CDU is one of our key strategic partners and leading institution in the United States.
I think we've got a little bit of an audio delay.
Have we lost Veronica?
Not sure.
I know Sonia is also on the line if she wants to pick up and maybe give a little bit of words to introduce Dr. Carlisle because she knows him best.
Sure, I can do just that. Thank you, Dr. Carlisle, for being here today. Dr. Carlisle has done an amazing job in transforming the Charles Drew University. I don't know if he's going to mention it today, but and for those of you that know, there was a moment when it was a little precarious at Charles Drew University, and we weren't sure what was going to happen over there. But over the years of him being the president there, there's been such a turnaround, and at the same time, there's also been an amazing turnaround of the community. Dr. Carlisle comes from an amazing background, having been, and I'm probably gonna get this wrong, so I apologize, was it the director of OSHPD? Is that correct? Yeah, all right. And a bunch of other amazing places he's had the opportunity, and a number of amazing institutions and entities and systems that he's had the privilege of working on, and coming from this perspective, always coming from this perspective of the community. So I don't want to belabor how amazing he is and how much I'm in love with him, which I know many of you are. So we'll go ahead and turn it over to Dr. Carlisle to share his words of wisdom with us.
Well, thank you, and good morning to all of you. And Veronica, don't worry about your audio. We will catch up, I know, later on. Before I begin kind of formally, I just want to say how taken I was by the kind of ad hoc remarks that we're bantering about as we were doing, as the warm-up was going on, and particularly to Michelle. I loved hearing about your plant coffee. That's really cool, and I can assure you that I'm on my second cup of coffee this morning, and I hope that the rest of the presentation goes smoothly. I will try to modulate my cadence a little bit because I know that we're doing simultaneous translation, and but let me know if I start going a little bit too fast here. So on behalf of the trustees, the faculty, the staff, the alumni, and especially the students of Charles R. Drew University of Medicine and Science, I am truly honored to be here kicking off the Community Health Council's third community-based research gathering, Exploration Summit, Women, Wealth, and Equity, Securing Our Economic Future. So thank you very much for inviting me. I want to begin by noting that Community Health Councils and CDU share a common origin story. CDU came into being after the Watts Rebellion in 1965, when the McCone Commission found that two of the causes of the unrest were lack of access to education and lack of access to healthcare. Our university was chartered by the state of California in 1966. Community health councils was founded in the wake of the 1992 civil unrest to provide greater health resources and support for South Los Angeles. So both of our organizations grew out of similar circumstances in our community. And we're both very much place-based and deeply rooted in South Los Angeles. And of course, communities like it throughout LA County, the state of California, the entire United States, and even the world. As I think about those threads that connect us, I also think that it's amazing that we've come so far. And yet I can't escape the feeling as I look around the country and throughout Los Angeles that we still have a way to go. The stakes are even higher for our community's health and well-being, and really our nation. We have a current public health crisis, a true pandemic that disproportionately impacts communities of color. We have a healthcare system that, at least at first, demonstrated indifference to the rapid spread of COVID-19 in those communities, with insufficient testing and too many examples of symptomatic people of color being turned away from hospitals. We have numerous encounters between law enforcement and men and women in color that have ended in unwarranted deaths. And we have a government at the federal level that is actively and often proudly antagonistic toward our efforts to increase the health of our communities and take steps towards social justice. I think this was really underscored, as we talked about earlier, by the events of last night's debate. So the question is, are we really that far removed from 1965? Are we really that far removed from 1992? It's fair to ask these questions, but we have to be hopeful, cautiously so, at the stirrings of positive change we see around us. As the Reverend Dr. Martin Luther King said, just 2 months before he was assassinated, we must accept finite disappointment, but never lose infinite hope. This brings me to the story of CDU and the community that gave rise to it, because CDU has always been a community-founded institution. Our history, our mission, and work have been defined by our place, by the poverty, deprivation, and lack of basic health, education, and social services, but also by the spirit, wisdom, energy, and inspiration of South Los Angeles. Nothing says more about CDU than our vision statement: excellent health and wellness for all in a world without health disparities. CDU has a unique role to play in South Los Angeles and communities like it. For example, by one, recruiting, educating, training diverse healthcare workforce leaders that low-income, under-resourced communities of color need. 2, staying engaged in South Los Angeles and bringing resources to it like COVID-19 testing. Earlier this year, CDU hosted one of the highest volume COVID-19 testing sites in LA County, testing over 70,000 individuals from April through August in partnership with LA County Supervisor Mark Ridley Thomas, LA County Department of Health Services led by Dr. Christina Galley, and the LA County Fire Department through Chief Darrell Osby. We achieved that high volume by listening to the needs of our community and adapting to those needs by taking walk-ups, by not requiring appointments, and by direct outreach to the community through our volunteers and trusted community partners. Our third unique role is by conducting research on conditions that disproportionately affect low-income communities of color. And finally, 4, providing advocacy and policy leadership on health equity issues through community forums, through direct work with legislators at the local, state, and federal level. We've recently held several online community forums on topics of interest to our community, including the disproportionate effects of COVID-19 upon African Americans and Latinx populations, and debunking myths about vaccines. I'm proud to say, as a CDU president, that we were founded by the South Los Angeles community that we have stayed in this community, and that we are serving this community. I'm also proud of our diversity at CDU, our diversity in all of its forms, as we've been ranked #1 in the country in faculty diversity and #2 in student diversity. In the spirit of this conference, Empowering Women, and since September is Women in Medicine Month, I'd like to share with you a snapshot of the absolutely indispensable role that women play at CDU. For example, our senior leadership group is comprised of our deans, administration, and program heads. In that group, 24 of 41 members are women. For example, 2 of our 3 academic deans are women, Dr. Deborah Prothero-Stith, Dean of our College of Medicine, and Dr. Diane Breckenridge, Dean of the Mervyn M. Dimely School of Nursing at CDU. And finally, of our entire student body, 68% of our students and 51% of our faculty are women. So now I'd like to tell you the stories of several of those women who represent the very best of Charles R. Drew University of Medicine and Science. The first is one of the founding members of our community faculty track, Dr. Loretta Jones. CDU was one of the very first originators of the concept of community faculty, in which local organizers and leaders well attuned to equity issues in their communities receive a faculty appointment at the university, a faculty appointment with full rights and privileges. Dr. Loretta Jones had a huge impact on community health, on CDU, and on me personally. Dr. Jones founded the Healthy African American Families Program, a community agency that facilitates collaboration among community organizations, academia, and government agencies to improve the health of communities of color throughout Los Angeles. We lost Dr. Jones around Thanksgiving of 2018, but her legacy lives on through Healthy African American Families, now headed by her daughter, Valika Jones, and her ongoing legacy of work at CDU. One story, I think, illustrates dramatically the impact Loretta Jones had. During the discussion we were having on some community health problems, I described a particular area as underserved. And Dr. Jones immediately educated, or rather schooled me, saying, no, not underserved, under-resourced. The reason communities are underserved is that they are under-resourced. She was right. She changed my thinking and the university's way of describing these sorts of situations. At CDU, we are grateful for Dr. Loretta Jones' commitment, impact, and enduring inspiration. The second woman I want to tell you about is Professor Cynthia Davis, an assistant professor and program director in our College of Medicine and College of Science and Health. Professor Davis is a hero in the fight against HIV/AIDS, working tirelessly on the front lines of this battle for more than 30 years. Professor Davis was instrumental in developing the first mobile HIV testing and community outreach project initiated in Los Angeles County way back in 1991. Since that time, she and her team have provided free HIV/AIDS testing and screening services to more than 60,000 Angelenos. In recognition of Professor Davis's exemplary commitment to health equity and social justice, as well as her unwavering tenacity in serving communities of color throughout South Los Angeles for over 3 decades, we established the Cynthia Davis Lifelong Learning Institute for Community Transformation in CDU's College of Science and Health. This institute supports projects for community transformation, as well as student and faculty engagement in community projects and community health education programs. Our third exemplary CDU woman is Watts native and CDU faculty member, Dr. Cynthia Gonzalez. How is this for a community connection? Professor Gonzalez was born in the original LA County MLK Medical Center. She went on to attend King Drew Magnet High School, right next to our university. She walked to high school across our CDU campus and returned after school to use the CDU library to study. And later, of course, Professor Gonzalez became a full-time faculty member at CDU for 5 years before taking a position as a senior project manager at Watts Rising, a collaboration of Watts residents, 40+ community-based organizations, and the city of Los Angeles. Demonstrating how vested in her community Dr. Gonzalez is. When asked how place has shaped her work, she replied, "It is my life." She too recognizes the gift that CDU's location, saying in a 2019 interview, "One of our biggest assets is where we are located. In South Los Angeles, we're not isolated from real lived experiences. We see inequity in our front yards. We see challenges that we're trying to address and how we're trying to improve quality of life." So I say bravo to all of our CDU women who are heroes at our university. But in closing, I'd like to tell you a story about a woman who's as special to me as she is to all of us here today. And that is the late Lark Galloway Gilliam. Lark Galloway Gilliam, of course, founded Community Health Councils in 1992 in response to the massive uprising that occurred after the unjust acquittal of LAPD officers in the brutal beating of Rodney King. A native of Los Angeles, raised in the old Sugar Hill neighborhood of the West Adams district, near where my mother currently lives, Lark intentionally placed the CHC headquarters in the cultural heart of the African American community on Stalker Street, only blocks away from Leimert Park. Lark's entire life was spent fighting against social injustice, beginning with the building of the Santa Monica Freeway that physically divided LA's African American community and forced thousands of people to relocate. A committed activist, Lark led battles against environmental pollution caused by the Inglewood oil field, against the food desert of South Los Angeles with its plethora of fast food restaurants, and against the epidemic of liquor stores in the South LA community. Former LA Deputy Mayor Romel Pascual said it best about Lark. What she was fighting and advocating for was not something she wanted so much as what the community deserved. Lark and I had a lot in common. We realized that if I hadn't moved away from Los Angeles to the East Coast at a young age, we probably would have met each other much earlier in life, as we grew up and went to school in the same neighborhood. Later, while working for the state government up in Sacramento, I used to drop by the CHC offices to say hi whenever I was in town, as they were only a couple blocks away from my old newspaper route. We shared a like-minded commitment against what Martin Luther King called the most shocking injustice of all, inequity in health, Lark's abiding and chief area of focus. But Lark was much more than an activist. She was a creator. The fact that we are holding this convening under the Community Health Council's banner today is living testimony to the impact that Lark had on an entire generation of future community activists. I was certainly one of those that she inspired. And we're certainly here today because of Lark Galloway Gilliam. In reality, she was always here for us. So in closing, I want to recognize another woman who represents the very best of Los Angeles, and that is none other than Veronica Flores, obviously the current Chief Executive Officer of Community Health Councils. I want to thank Veronica for carrying on the tradition and memory of Lark Galloway Gilliam as CHC continues to empower, inspire, and energize our South Los Angeles community in our battle against social injustice and for health equity. Thank you all very much. It's wonderful sharing this morning with you, and congratulations on all that CHC is doing to improve the lives of everyone in South Los Angeles and beyond. Thank you very much.
Thank you, Dr. Carlisle. Great words, but more importantly, great insight to the women, not only that call and have called CDU home, but how the impact has been to our community. We'd like to open it up for questions for Dr. Carlisle. You touched on a handful of things, especially women in particular. But since our focus is women and equity in terms of securing our economic future, I'd like to ask for folks to participate via chat and post some questions for us that we can ask Dr. Carlisle this morning. As folks, Dr. Carlisle, begin to ask us some insight or questions based on some of the remarks you made, tell us a little bit about what you're seeing now in terms of women and in our community. You touched on what is happening with not only the call to action you did with the community in testing, right, as the pandemic started unfolding, but in particularly, what are you seeing with women and the impacts to their future economically because of the pandemic right now in our community?
Well, I would say that women in many ways are especially bearing the brunt of COVID-19. Whether it is having to raise and stabilize families, often as the pillar of a given family, often while at the same time working in essential jobs throughout our community. Women are there on the front lines and are really the agents of change in terms of addressing COVID-19. Women play, a variety of very important roles, obviously, and one that I want to speak to was portrayed by our professor Amaro Del Pino, who recently was interviewed by Sylvia Drivey at CDU, and he actually did a research project that had a very interesting finding in determining access to HIV services. It was more important than reaching out directly to the clients who were afflicted with HIV to reach out to the women who were connected to those individuals, mothers, sisters, daughters. By reaching out to the women, Dr. Del Pino was able to demonstrate that the individuals that they were trying to reach were much more likely to be motivated to seek anti-HIV/AIDS services to fight the infection. So that's just an example of the role of women. And again, not just in HIV and the battle against it, but in healthcare in general. Women, of course, have massively pivotal roles.
Thank you, Dr. Carlisle. A question we do have from our participants is that as we talk about systems change efforts today, it's important for us to continue to remember the history of our social justice warriors, as we've all pointed out, and more importantly, you've shared with us this morning as our first presenter. How are you seeing CDU ensuring that our new medical and public health workers learn from this history, but what you are actively seeing in our community today?
Well, one of the things that we do at CDU is we make sure that everybody at CDU is imbued with the mission of our university. I make it a point to interact with, and now virtually, every new employee at CDU during our new employee orientation. I make it a point to welcome all the new students to CDU. And in doing so, make sure that I'm able to convey, number one, who Dr. Charles Drew was. Number two, why our university was created in the first place to respond to issues of social injustice. And three, how we are doing it and why we are special. I want to make sure that everyone at CDU knows that we are a special university with a special mission, serving a special community. And that's what makes us unique and empowers us going forward.
Yes, absolutely. Thank you. Another question that has come in from participants is, as you see the healthcare profession really hit and be, of course, at the front lines and continue to deal with the issues at hand, what are you seeing for the future of our healthcare professionals, and particularly women, and in the areas of research, in the areas of health disparities and equity issues?
Well, one of the really transformational things that has occurred in healthcare is the verticalization of the participation of women at every level of healthcare organizations, deans, CEOs, presidents, physicians, nurses. At every level, you're seeing an increased participation and presence of women. This is really transforming, I think, how we deliver healthcare and how we approach healthcare in general. It's a positive development. We're seeing other changes in the health professions. A major focus on primary care. For example, just this week, my former department, the Office of Statewide Health Planning and Development, issued over $15 million in grants for health professions workforce development. Those grants were focused on primary care and behavioral health care. And this is the government of the state of California saying, this is what we want to emphasize, putting our money where our mouth is, literally, and not just talking the talk, but walking the walk in terms of transforming how we deliver healthcare. I recently served on the California Future Healthcare Workforce Commission, and that commission also spoke about the need of diversity in healthcare, the need to emphasize primary care, the need to emphasize prevention. So I think that with the presence of so many people who reflect those values and are committed to those goals, increasingly in leadership positions in healthcare throughout the state of California. And for example, Mark Galley, our Secretary of Health Services for the state of California, we're just seeing, I think, a real paradigm shift in how we go about delivering healthcare and targeting improved health for our LA County and California populations.
Thank you, Dr. Carlisle. A follow-up question. I know we have two, the follow-up and then one more for you this morning. Today's the last day that the governor has an opportunity to take action at the state level for this legislative session. We know that you mentioned Dr. Galley, and the governor announced a health index that's very specific for health disparities. What is your thoughts for women and equity and the paradigm shift that you're seeing continue as we look collectively into the new year? You know, we have many leaders participating this morning that would love to partner, I would imagine, further with SDU, and also how we can collectively look at a platform to further where the governor and Dr. Galley are headed, but where do you see some opportunities as we look to the new year?
Yes, I can't speak really effectively about any specific legislation, but I recognize that we're seeing increased opportunities for focusing on priority areas. With all the downside of COVID-19, one of the things that it has allowed us to identify and focus on, for example, is how stressing the healthcare system and stretching the system has exposed vulnerabilities that we all know exist, but has shed greater light upon the vulnerabilities of under-resourced communities. As a result, I think that we're seeing kind of a groundswell of sentiment about directing increased resources to under-resourced communities and populations. And I hope, but I also think that this is not a kind of a one-time phenomenon. I think this really represents a foundational shift in how we perceive health and healthcare and the relationship between health and healthcare. I think our leaders, even though they may be traditional healthcare individuals, they recognize it's not about, health is not all about healthcare. or maybe there's more to healthcare than simply going to a hospital. Healthcare starts with the beginning of our lives and before. It involves prevention, it involves public health, it involves nutrition, it involves all those social determinants. And everywhere I go, everybody that I speak to understands and appreciates the relationship between all of those elements, culminating, but hopefully not, maybe, in hospitals. Hospitals are no longer necessarily the pinnacle of our healthcare system. We don't want individuals to end up in hospitals. So when we talk about health, we're recentering the center of gravity of our policy in terms of health to prevention, and I think really ultimately improving the general concept of health. This is a very good thing, and I think it's a definite change.
Thank you, thank you. One last question for you, Dr. Galley. That's Dr. Galley. I'm already calling you Dr. Galley because we're talking about that.
No worries,
Dr.
Diane.
Carlisle, is that one question from participants is that what are some ways that women can get involved in leadership positions in California and in LA in ways that can promote health equity for our communities? What are you seeing as opportunities and specific pathways for women?
Well, I see lots of specific pathways. I see lots of leadership opportunities, and you know, when I look at women or our leaders in healthcare in LA County, and you know, I would include, for example, our public health director Barbara Ferrer. I mentioned Dr. Christina Galli already. The list just really goes on and on. I mentioned our deans at CDU. I would keep pursuing those pathways. Because I think that there is a realization, a functional realization now of the importance of having women in leadership positions because of the perspective that they bring, and it's not just an equity issue, but it's really a functionality issue, and if we want to be optimally functional, we should encourage diversity of all types in leadership positions, particularly gender diversity. I will say that I think that the increased presence of women in corporate boardrooms, for example, running organizations as CEOs, has actually had a transformative impact on how organizations do things in the United States. And I think this is a definite positive change that I've seen in my lifetime, and I'm looking forward to seeing where this goes as we go further down this pathway.
Perfect. Thank you so much, Dr. Carlisle. There are more questions coming in, but I know we want to be cognizant of time. We appreciate you spending your morning with us, and if you're able to continue to stay with us, but we'd like to make sure to thank you, and there's more questions coming in, but know that we will follow up for those that are asking questions. We will follow up not only throughout the session, but thereafter. So thank you, Dr. Carlisle. We appreciate your time this morning, your wisdom, and your reminders for why we are here and what the call of action is as we continue forward. Thank you.